It has been a year since the pandemic gripped Singapore. The panic buying, the tension, and the initial shunning of the healthcare workers in public. It is easy to forget the difficulties in the beginning. Looking back, we found this. Who's behind Be Kind SG?
Earlier in 2020, we actually jumped on board with Sherry to help give out care packs to the healthcare workers at Tan Tock Seng as well as NCID. Powerful woman, took a lot on her shoulders, so we were there to see how we can help as much as we can.
The 7,000 care pack for Tan Tock Seng Hospital and also NCID. I think in that I really got a sense of the tenacity of Sherry. You know, if I put myself in that situation, I think I would experience a lot of empathy, burnout. Like I don't know what to do. I turn my head away and then I just, feel so overwhelmed and I don't do anything. But Sherry actually, goes forward, no matter how difficult it is.
Because at that point of time, there wasn't much news about the healthcare workers, but I was reading the newspapers and seeing that they were sent into this place called, National Centre for Infectious Diseases. So that was when I got the idea that, okay, maybe I will do something to appreciate these healthcare workers, and I emailed NCID, then got the number, and that was when I embarked on this huge project, which was I didn't know that it was logistically so challenging. I kind of underestimated the challenges that it brought. My phone was just ringing like 24/7, like through the days, and I felt at some points of time I couldn't really ask my volunteers to help me because they're all working adults, and the liaising and the coordination, a lot of it was done during the daytime. There were some points of time that I felt like, was it really necessary to, be so determined to get that, not just the 7,000 care packs, but the 7,000 thank you cards, individually drawn and created thank you cards into the care packs, because there was coordination with so many schools, so many institutions. Yeah, but I think when the project was over, it was very touching because I think there was one healthcare staff, but she actually went through all our albums and then found that photo of this preschooler drawing the card that she received, and then she wrote a message. Really told me that, it is important, this little appreciation and encouragement. So Be Kind SG was started to kind of realize that we all can play a part, like you as an individual at your age, by treating people with a non-judgmental. Okay, so today we are at Chatsworth International School, and I was actually engaged by Serendipity, which is a social enterprise, to get the kids involved in doing good. And two of the activities that we did today, one of them, which is here, is our #Craft for Good session, where the kids actually crafted Valentine's Day cards for our residents' friends at Moral Welfare Home and Tawakwa Home for Disabled at Singapore. When I first started Be Kind SG, so one of the focus was to focus on less visible communities. That is quite a wide range, but I knew that one of the groups that I wanted to focus was adults with special needs. So I think that was how it started.
Be Kind SG aims to engage invisible communities, and Sherry is a permanent resident in one, the autoimmune disease community.
Her struggles are mostly from people's expectations of her. They don't know that she actually has a condition. I remember she told me that once she was helping out at an event, and one of the ladies was telling her, can you take this and go somewhere quickly? Like something like that. Then I think what happened was that she cannot walk quickly. She thought she was walking quite slow, right? I think the lady saw her walking slow, then she ran to her and then okay, never mind. Then she took the thing from her, then she ran off.
I'm part of the autoimmune disease support group. It was founded by Sherry, so that's how I met her in 2016 when I was diagnosed with rheumatoid arthritis, and I was searching for a group of people who were like me and we had more information. At its worst, I could not walk, I could not dress myself. It was even hard to eat because it actually affects every single joint everything was swollen. So although on the outside I look very normal, but if you look very closely at the way I walk, you will realize that I actually have difficulty in moving around or doing some small actions.
At first it was just a foot drop, then after that drop again, then really cannot move. Then later it progressed, go and find out more, go and see this doctor. Every time it happened, then go and back. We realized this one is a ticking bomb one. You don't know one.
You know, I've been suffering from autoimmune disease, vasculitis, for over 20 years, and it's a very invisible condition because you cannot tell from my physical outlook. You know, if I were to tell you that I have a lifelong medical condition, you know, taking lifelong medications which, you know, impair my life. But if you look at a snapshot of my social media, you look at my travel photos, you're like, okay, there's no way this girl is as sick as she says she is.
Besides Be Kind SG, Sherry is very much involved in another organization for many years now. And we are following Sherry on this important day, an accumulation of many months of preparation.
She is a volunteer wish granter. So essentially, wish granters in Make-A-Wish, they take on wish assignments for us, and they are the ones who work with the child to discover what their one true wish is and to grant the wish. And these assignments take up from 3 months to all the way to 10 months long. And Sherry is one of our really talented wish granters, very dedicated. So aside from being a volunteer wish granter with us, Sherry has been very proactive in terms of looking for opportunities where we can benefit our wish children even more. So whenever she sees, a potential funding source, she lets us know, or a potential donor who is providing some sort of service, she always alerts us and says, hey, Nora, this might be a great opportunity to collaborate as well so we can benefit more people.
My sister is 8 years older than me, so when I was, you can imagine there's quite a huge age gap, and in terms of the thinking as well. So you can imagine when I was in primary school, she's like in secondary school. I think I remember, I don't know if she remember or not, but I think in JC when she was to go on her first overseas trip away from home, I cried. Yeah. I think around secondary school, I started to get in trouble with my mother, who was very strict. Yeah, so my sister, no choice, I think. Sometimes have to be the mediator, or if I get locked out of the gate, sometimes she has to come to my rescue. We had to downgrade for one, and then one we had to move because my dad had stroke. And then I think that flat that I was living in was on the 10th floor, and that those times they have the lift doesn't stop at every level. So we had to move to another one that was on the lift level, which is on the 6th floor.
She's very nice. She is very soft, very gentle, but she is also those that doesn't stay in the classroom. So she was always out of school. Yeah, so it's very different that her commitment towards this invisible community now compared to the commitment as a student when we were a lot younger.
In the beginning of our friendship, usually she's the one taken care of, like she's the princess. From one that use chopstick also got issues. I used to scoop up noodles for her into her spoon and make sure she got one serving every time so she can just eat.
Seeing how driven she is, one wonders where is the source of Sherry's altruism.
It's a question that I've always asked myself. Why is such an inherent desire to want to do good, to be kind? Because this is a girl who lost her parents at quite a young age.
I think she is not wanting to be kind. She like that. It's not she want to, She just can't walk away. That's her problem. She cannot say no one.
你知道她有那个对那个叫做免疫系统的病对吗？可能她也是好像我这样感同身受人家需要帮忙的情况，但她又有这个能力去帮人家，所以她才会 一直要做这个volunteer 的 work 咯。
Because I know that she can understand that the sense of hopelessness and being lost when we cannot do anything to control our situation.
I've seen her disheartened. That's not a volunteer. That's not just a volunteer for me. You know, when we say, because I do volunteer whenever I have time and when I can. But for her, I don't think so. It's just volunteer work. I think it's personal to her. She takes it like that.
It takes a village, and some regard her as more than a friend.
When we first got to know each other in JC, she was my guardian angel. She was my, basically, she was the one who approached me first when I needed someone.
We do silly things like we stay in different hostels, but we will walk in the rain to go and find each other. Yeah, I think those were the fun days. But I think when she got married and she got busy with kids, then I guess we didn't always meet each other very often lah. But actually, some friends you don't have to, always meet, always talk to each other. But you know that if anything happened, that will be one of the first few people that you call, and that person will drop everything, to go to you. So I think Qing is one of definitely one of those people. I mean, we went through a lot of things together lah, but I feel there's some parts of her life. Yeah. I mean, I feel that there's some parts of her life that I let her down. I mean, she went through some really dark times in university, but I don't think I helped her enough lah. I mean, I was there, but I couldn't stop what she was doing.
Perhaps a glimpse of what makes Sherry Soon, her drive, and her heart of not letting anyone down. On the last day of shoot, it's another typical day of Be Kind SG. Sherry is hosting a workshop in her home again. What is Sherry's wish for Be Kind SG in the future?
I don't know, that kindness, looking out for other people, being understanding, being patient, being non-judgmental, that all these exist and becomes the top at the forefront when we do any activities.